Many people take breathing for granted. For a person with asthma, it can be a struggle just catching your breath. We're here with Dr. Marc McClelland to learn a little bit more about that. What is asthma?
Sure. So asthma is a chronic lung condition that can affect children or adults. Asthma specifically affects the airways or bronchial tubes, which allow a patient to move air into and out of their lungs. And there's a couple of components of asthma, but one is inflammation in the airways, which can lead to cough and mucus production. And asthma also involves a narrowing or constriction of the airways that can make it very hard for a patient to breathe. And typically they'd experience shortness of breath, wheezing, or difficulty in performing exercise or physical activity.
Yeah, what can trigger asthma?
Sure, good question. A number of different things can trigger asthma. Certain allergens in the air, such as pollen, dust, perhaps dogs or cats for patients who are allergic to those animals. Sometimes extremes of temperature can trigger asthma, so hot, humid days in the summer, cold days in the winter. And importantly, often physical activity or exercise can trigger asthma, and often that limits a person's ability to perform exercise.
When should a person seek treatment, and what are some of the options?
Sure. Really anybody who's having the respiratory symptoms that I described, a persistent cough, shortness of breath, wheezing, sensation of tightness in the chest, somebody like that really should ask their doctor about what might be causing that and seek care. There's a number of different treatments once asthma is diagnosed. Certain forms of inhalers can treat the inflammation or the narrowing or constriction in the lungs that may relieve that shortness of breath or relieve the cough. There are certain pills that are available, and very important would be avoiding triggers of asthma, especially cigarette smoke and those sorts of things.